All right, guys, we're going to start with the abdominal workout portion. This is retraining abs that one have lost their endurance through either injury, lack of use, or pregnancy is another big reason. We're going to start with just an awareness, developing some neural connections, some motor control. We're going to start with what's called the stomach vacuum. There's three components to that. The first one is going to be getting the transverse abdominis to activate. And so you have these little prominences on your hip bones here right in the front. What you're going to do is you're going to focus on the muscle that's just inside of those. So if these are the bones just in half an inch inside, if I put my fingers here, these are the muscles that you're focusing on. What you want to feel is it's called a stomach vacuum because your stomach hollowing. What you're going to try and do is you're going to think about taking these two bones, using those muscles, and trying to pull those bones inward together. The stomach kind of pulls inward as you're tightening those muscles. And if your fingers are here, you can actually feel those muscles tighten. What you're going to do is you're going to try and hold that. You may be able to start out with about a 5-second hold. And work your way up to where you can do at least 30 seconds. So that's the first part of the three parts of the stomach vacuum. The second part, and I'm going to get a little bit personal here, but the second part involves your anus. You're going to think about taking that part of your anatomy, and one of two things. You can either think about pulling it forward towards the pubic bone, so you're thinking about taking those muscles around the anus, and you're pulling inward and upward or forward towards the pubic bone, which is just below the belt. Another way to think about it is if there is a string attached to your pelvic floor or those muscles around the anus, you're going to think about that string being drawn upwards and those muscles being pulled upwards along that drawstring. Okay, so we have the bones here. You're pulling those inward with the muscles of the TA. The pelvic floor, you're pulling that anus upward or up and forward towards the pubic bone. And the third part of this stomach vacuum is you're thinking about the muscles that attach to the pubic bone, which is just below your belt. You're thinking about pulling those upward. All right. So overall, we have this combined action of these muscles being pulled up and inward, which draws the stomach inward, creating a vacuum or a hollowing of the abdominal muscles. So we're activating all the muscles of the transverse abdominis and pelvic floor. All right. So each one of those you can practice separately. We're going to start out with at least a 5-second hold and work your way up to doing 30 seconds, and then also work your way up to where you do all three of them together and hold that for up to 30 seconds. And then we're going to progress on once you've got, and you can do that throughout the day. It doesn't have to be a dedicated time. You could be, in between, typing things up on the computer or going to and from the car or in the car while you're driving. Just wherever you can. The more that you get it done throughout the day, the better. So I want you to think about doing that when you're first starting out. I want you to do that at least 10 times for each muscle group in every single day, building up the amount of time that you can do that. And then the next thing we're going to do is we're going to do what's called a decompression breath. So we're going to create length in the spine while creating tightness around the abdominal area. So I have to apologize, but I do have to take my shirt off for this so that you can see what we're trying to create here. So just 1 second. Don't make fun of me. So what we're going to do here is we're going to think about, as we take a breath in, our chest is going to get as wide and tall as possible. And as we breathe out, our chest is going to stay big, wide, and tall. And we're going to do that vacuum or pulling in of the abdominal muscles by activating all those three components that we talked about. So this is what it looks like in action. I'm going to do kind of a profile view so you can see my chest getting bigger and taller as my stomach gets more narrow. I'm going to do 3 breaths here. I'm going to have my shoulders kind of pulled and squeezed back tight. My neck is going to be nice and tall and long. I'm going to take a breath in and out. So with each breath, my chest gets taller. It never falls down, and my stomach gets more and more pulled in. And then I can relax. So I'm going to do somewhere between 3 to 5 of those breaths Each time getting taller and bigger, pulling the ribs up as much as you possibly can. Take a very, very forceful breath in and a forceful breath out, really contracting all of those muscles and pulling that stomach inward to create tension around the whole midsection here. All right, now that you've seen that, I get to put my shirt back on, and we're going to go into that same decompression breath, and we're going to do it in a couple different positions. So we just demonstrated standing. The next thing we're going to do is we're going to do it standing again. We're just going to do a different position with our hands. So we can do an overhead, and I'll back up a little bit so you can see me. We can do an overhead decompression here. The fingertips are pushing together and reaching towards the sky as high as you can get. As the chest expands and gets taller and wider at the same time. Then the stomach gets more narrow and more tight throughout the whole core section. Arms come down. All right, we're also going to do in a lying position, so face up. We can replicate the exact same thing. Hands are going to be overhead. And we're going to repeat the same thing. Breath in. Expand the lungs, get tall, breathe out. Keep the chest and spine long while you contract the muscles of the stomach and core. It's also good to do this in a bent knee position as well. All right, and then the third way we're going to do that decompression breath is in a slightly flexed position. So your shoulder or your feet will be shoulder width to slightly shoulder width or slightly wider. We're going to pull our shoulders back, hands by your side, kind of squeezing your elbows in tight by your side. Chest and head is tall. We're going to slight bend in the knees, just barely, just kind of like soft knees is the way I describe it. And then rock the hips back about 2 inches. And we're going to do some breaths here. Each time getting tall with the chest. Wide with the chest. Fill those lungs as big as they can get. And as you breathe out, really narrow that stomach, create that vacuum. And then you can rock the hips forward and come tall. And you can exaggerate that or increase that bend or flex in the hips more and more and more as you get comfortable. You can also do that in an overhead position here and do that breath here. I'll show you what that looks like. In this position, you're really going to feel it in the low back, the muscles activating there in the core as you breathe out. Just because your hands are overhead, you're creating more weight out in front of you. So you're creating more of a bracing of that core section, which is really a little more advanced and a good progression to build strength here as you're doing that. All right, so now we got the core really activated. We're moving on to the two final movements that we're going to do. One is a bridge and one is a plank. We're going to start with the bridge. We're going to be laying on our back. Knees are going to be slightly bent. Ankles will be bent. Hands will be flat by your side. What we're going to do is we're going to create that hollowed position of the stomach by pulling the pelvis or tilting it towards us and pulling all those muscles inward, the transverse abdominis and those muscles of the pelvic floor and the lower abdomen. We're going to pull those inwards, and then we're going to lift our bottom off the ground by pulling our heels towards our bottom. So it looks like this. Knees just slightly bent. Ankles also bent so that we're on our heels. Hands are going to be flat on the ground. Head will be relaxed back. We're going to create that hollowing of the stomach, pulling all those three muscles inward, creating that vacuum, having the pelvis tilt upward or towards us. And then what we're going to do is we're going to lift the hips up by pulling the heels towards your butt. One last thing with this one, in this position, we're going to want to push our hands into the ground and squeeze our knees slightly together. We want to create a lot of tension by pushing into the ground, squeezing the knees together, and pulling the heels towards the bottom. All the while maintaining that contraction of those 3 abdominal muscles, the transverse, the pelvic floor, and the lower abdomen. And then we're going to do our breaths. As you breathe out, contract those muscles, create more tension, push more into the ground, pull your heels more toward your bottom, squeeze your knees tighter together. And we'll lower down. We'll do 3 to 5 breaths in that position. And the last one is going to be on our stomach. We're going to do a bridge here, kind of a modified bridge. Some of this I'm pulling from Dr. Eric Goodman, his foundation training. Some of the positions that he uses to create a strong, healthy spine. In this one, our elbows will be slightly out in front of our shoulders. They won't be directly underneath. They'll be slightly out. Fingers will be spread wide. Ankles will be bent so the toes are on the ground. And your knees are going to be together. Again, we're going to create some tension they won't be together, they'll be slightly apart. You're going to be pulling them together. You're going to create tension by pulling them together once we get up in the plank position. To get up in the plank position, we're going to pull our butt backwards and pull our stomach inwards like we did when we created that vacuum. So the pelvis is tilted inwards and upwards. We don't want to see an arch in the low back like this. We want to see the stomach or the pelvis tilted or pulled forward, creating that vacuum in our stomach, or hollowing. So in this position, we're going to be pulling our elbows towards each other. We're going to be pulling our knees towards each other, creating tension there. We're going to be pulling our elbows towards our knees, or towards our belly button, and our knees towards our belly button. Pulling everything inwards towards the center, and breathe. As you breathe out, create more and more tension by pulling elbows inward, knees inward, elbows and knees both towards the belly button inwards towards the spine. And tilting that pelvis. Think about that pelvic floor, pulling that pelvic floor towards the pubic bone or up on that drawstring. And then we'll relax down. 3 to 5 breaths in that position. That one you should really feel a lot of engagement of the core muscles, and you should get really fatigued doing that one. All right, once you've been able to do all of those positions, and you're able to hold the bridge and the plank with a lot of intensity, and no issues there in the low back, you're ready to progress on to most abdominal workouts, and you've created a really strong core. Remember to do this every single day. Even once we've gotten to a good active state and we've built a lot of strength, you want to maintain that strength. All right, guys, have fun.